Another day, another story. Bird flu, or avian influenza, is caused by influenza A viruses that primarily affect birds but can sometimes infect humans and other animals. The origins of bird flu trace back millions of years, evolving alongside bird species. However, the more recent history of avian influenza, especially highly pathogenic strains like H5N1, can be tracked through modern outbreaks. Welcome to Tabo Eminent Channel. Origins and evolution. Natural reservoir in wild birds. Influenza A viruses naturally circulate in wild waterfowl, such as ducks, geese, and shorebirds. These birds often carry the virus without severe symptoms, allowing it to spread globally. Mutation and spillover to domestic birds. When wild birds interact with domestic poultry, chickens, turkeys, ducks, the virus can mutate and become highly pathogenic, HPAI. This leads to severe outbreaks in poultry farms worldwide. Emergence of H5N1 and other dangerous strains. The H5N1 strain of bird flu was first detected in geese in Guangdong, China, in 1996. By 2003 to 2005, H5N1 spread across Asia, Europe, and Africa, infecting both birds and humans. Transmission to mammals and humans. While bird flu mainly infects birds, human cases have occurred through direct contact with infected birds or contaminated environments. In rare cases, mutations allow transmission to mammals like seals, foxes, and even cattle, raising concerns about potential adaptation for human spread. Avian influenza has been sickening birds at least since the 1800s and has been a factor in the emergence of human pandemics. Bird flu, or avian influenza, might seem like a relatively new phenomenon to the general public. But the disease, technically called highly pathogenic avian influenza, HPAI, has been sickening birds since the 1800s, and likely much longer. And in humans, cases date at least as back to the 1918 flu pandemic. If scientists could have surveyed wastewater hundreds of years ago, they might have found it had been circulating for much longer. Understanding the history of bird flu can help reveal potential risks for a future pandemic, says Catherine Pauls, an infectious diseases physician at Penn State Health Milton S. Hershey Medical Center. 1878, fowl plague detected in poultry. In 1878, a veterinarian in northern Italy noted a significant uptick in poultry dying. With a limited understanding of viruses at the time, people called the disease fowl plague. At first, it was confused with fowl cholera, which is caused by a bacteria. At the time, concerns centered on people's livelihoods, not on human health, explains Andrea Prinzi, a former clinical microbiologist at Children's Hospital Colorado. In the 19th century, the disease could spell financial ruin for a poultry farmer. They weren't necessarily as concerned it would infect humans, says Prinzi, who also serves as a field medical director of U.S. Medical Affairs for bioMérieux Incorporated, a biotechnology company. Although this instance in Italy is the first known reference to the disease, avian flu had likely been sickening birds for some time. History Shorts, Getting Back to Sports After a 1918 Pandemic, Forged in Crisis. 1901, bird flu identified as a virus. By 1901, scientists had identified the cause of fowl plague as a virus. They were able to do this by observing its ability to pass through a filter. Viruses are significantly smaller than bacteria and so can pass more easily. The disease eventually spread to eastern Austria and Germany, and later to Belgium and France, likely through traveling poultry merchants. 1918 pandemic, later linked to avian flu. Amid the devastation and disruption of World War I, a flu pandemic surged, claiming more lives than battles did. The first well-described flu pandemic, according to Pauls, resulted in about 50 to 100 million lives worldwide. That strain was really good at making the healthiest people in the population the sickest. The immune response was so severe, Prinzi says. Technology later determined the virus to be an avian-like H1N1 virus. 1920s, sporadic outbreaks among birds. Avian influenza caused sporadic outbreaks worldwide among bird flocks. In the United States, the disease struck live bird markets in New York City in the winter of 1924-25. For unknown reasons, few outbreaks were reported in the 1930s and 1940s. 1957, researchers link avian and human viruses. By the late 1950s, poultry across Europe, Russia, North America, South America, Middle East, Africa and Asia had been affected by bird flu. The number of birds affected varied greatly, from small flocks on a single farm to tens of thousands of birds. In 1957, a new flu virus emerged from an avian virus, beginning a pandemic that killed over 1 million people worldwide and 116,000 in the United States. And for the first time, a study suggested a link between people and bird flu viruses, finding a connection between the new virus and a virus in a turkey. Around the same time, scientists started realizing that wild birds could carry flu viruses, acting as reservoirs, and confirmed it with blood tests in 1968. 1968, seasonal flu, bird flu combine, triggering pandemic. In 1968, a seasonal flu virus mixed with a bird flu virus to form a new virus better able to infect humans. 1981, avian influenza is coined at the April 1981 gathering of the first International Symposium on Avian Influenza in Maryland. Researchers agreed to discard the term fowl plague and replace it with the more appropriate term highly pathogenic avian influenza, HPAI. 1996, first known human fatalities from H5N1. In 1996, a new strain of avian influenza, H5N1, was identified in aquatic birds in southern China. 18 infections in humans result in 6 deaths, the first known H5N1 human fatalities. It was really lethal, and people started paying attention, Prinzi said. 2005, avian influenza flagged as top health concern. Increased surveillance led to the detection of various outbreaks of avian influenza among both birds and humans, including new, or novel, strains. In 2009, for example, H1N1 was detected in humans. The novel virus spread from the United States around the world. It also highlighted that bird flu can be transmitted through intermediate hosts, in this case, pigs. The disease had finally caught the attention of the public. 2022, birds to minks to humans. When minks fell ill with H5N1 on a farm in Spain, presumably from exposure to birds, virologists were alarmed. In early 2023, 2 workers from the farm tested positive for H5N1. So did Prinzi. When a virus jumps from an animal to a human, there's a better chance it will evolve into a strain that could cause a pandemic, she says. 2024, first known cow-to-human transmission. In the spring of 2024, dairy cows on farms in Kansas and Texas were reported to have H5N1. In April, a farm worker tested positive, marking the first known cow-to-human transmission of H5N1. By January 2025, there were 67 confirmed human cases in the United States, according to the Centers for Disease Control and Prevention, including 1 death. Testing suggested that the virus mutated after the person in Louisiana was infected. Why is bird flu a concern? Economic impact. Millions of birds are culled during outbreaks to prevent spread, affecting food supply and poultry industries. Pandemic potential. If bird flu mutates to spread easily between humans, it could cause a global health crisis. Recent developments. In 2024, H5N1 outbreaks in dairy cattle and potential spread through milk have raised new concerns about human transmission. Thanks for watching. Request you to subscribe the channel.